Good afternoon. You are here for the Workplace Drug Use and Testing in a New Era webinar. Welcome. We are going to get started here. I know many of you are probably eating lunch at this time, so we have muted everyone just to keep the quiet down so that you can hear all the speakers. If you do have a question on your control panel there, if you need to open it, there's a little orange button that will open up your controls. You can either raise your hand, there's a little hand button there, you click that, you'll raise a hand and we can unmute you if you'd like to ask a question. We are going to try to keep all the questions towards the end of the presentation, but if you do have dying questions, feel free to ask it when you want to. Alternatively, if you don't want to speak on the phone or if you're using your computer speakers and might not have the option to use a headphone, there is a little question box as well, so you can ask questions either anonymously as well or with your name if you'd like to be identified with your question in the text box there. I've also sent through, there's a little chat feature as well. Dr. Saito in his presentation will be asking a few questions using his poll system. You can access that via your web browser or you can access it via your cell phone. There's a link in the chat box, and Dr. Saito will also include the link in his slides as well once we get there. At this moment, I'm going to turn the presentation over to Mike Gendrew of Maine Community Health Options, who is sponsoring this series.
Thank you, Caitlin, and good afternoon, everyone, and thank you for sharing your lunch hour with Community Health Options. Health Options is a nonprofit, member-led health insurance plan providing comprehensive health insurance benefits to individuals, families, and businesses. We're a Maine-based, headquartered in Lewiston, and we have member service associates located in Lewiston and Fort Kent who are ready to answer your calls and questions. We provide affordable, high-quality health benefits through productive partnerships with members, businesses, and a broad regional network of providers throughout the state of Maine and beyond. We are governed by a board of directors, a majority of whom are Community Health Options members, which ensures that members have a strong voice in the management and development of the products and services we offer. Today's topic, as Caitlin mentioned, is workplace drug use and testing in a new era. Our presenter today is Dr. Kenji Saito. Dr. Saito is the Medical Director of Workplace Health and Regulatory Liaison to Maine General Health and is a board certified in preventive medicine with specialty training in occupational and environmental medicine. Dr. Saito is also an adjunct professor at Penn, teaching occupational and environmental medical residents, pursuing medical, legal, and occupational ophthalmic endeavors, and engaging population health and promoting prevention through wellness and health programs. So welcome, Dr. Saito. Today's agenda is simply Scott Good will set the context. We'll address special challenges associated with marijuana opioid use issues in the workplace. We'll review techniques to perform substance use assessments in the workplace. So Scott Good is a principal at Crescendo Consulting and lead consultant to the Harbor Performance Initiative, or HPI. The HPI is comprised of the nation's leading behavioral health organizations and psychiatric and substance use treatment facilities who are committed to helping participating organizations improve the quality of their care and enhance their operational best practices in a rapidly changing healthcare and reimbursement environment. And so with that, I'd like to thank Dr. Saito for joining us, and I'll turn it over to Scott Good.
Mike, thank you very much. Good afternoon, everyone. This is Scott Good. Our goals for this afternoon are to develop a clear understanding of drug use trends and the workforce impact. Secondly, what we'd really like to do the next short time period is to develop some reasonable structures to move forward. And this first slide here, looking at opioid sales since 1999, that really is the start of the conversation. Because since that time, there've been a lot of changes. Certainly, if we look at our world right now, the employer world, there's a lot of workforce drug policies that sometimes conflict or are at least difficult to reconcile with federal regulations, and not to mention state of Maine regulations too. In addition to that, compared to 10, 15 years ago or more, employers' priorities have changed also. 10 years ago, we might be having a more in-depth conversation about health care or coverage in that respect. But now there's a lot more conversations about retention and hiring the right people. And certainly the whole conversation about drug use and opioids is instrumental in that discussion. But you know what? This is our worldview now. This is the world that we live in. And so we're going to talk about this question in a little bit greater context. And then also we're going to identify some pathways forward. What do we do as a reasonable approach? Okay, Caitlin, if you'd like to advance that slide, please, that'd be helpful. Great, thank you very much. Well, this sets the context a little bit. You can see here that the number of deaths due to drug overdose has more than doubled in the past 15 years or so. And that's the same for males and females. It's really tragic. And certainly for employers, the impact of drugs, not to mention deaths, obviously, but drugs into the workforce can affect productivity and safety, lost time issues. They impact the they impact the employee's family as well. Not to mention the impact if an employee may not have a drug or substance issue, but if a family member does, there's still an impact on the employer, isn't there? Certainly, we mentioned hiring and retention earlier. That's quite a challenge. We here at Crescendo, we do a lot of substance abuse and community assessment work throughout the country, and we were at a site recently where one employer was lamenting honestly that she had interviewed well over 150 people for a particular job, finding only between 3 and 5% that were able to pass an initial drug screen. So that certainly might be an extreme case, but it certainly highlights the issue that a lot of us face. Regardless of hiring and retention, the cost of insurance, the cost of care is an ongoing challenge for employers. Okay, the next slide, please, Caitlin. Great, thank you. One too many. Great, thanks. Well, let's talk in a little bit more detail. Certainly, opioids are on the front page of most every newspaper these days. So let's look a little bit more deeply at this. Deaths due to opioid drugs over that same time period, 2002 to 2015, have approximately tripled. And if we were to dig into these numbers a little bit more, we'd see that deaths due to heroin overdose increased from 2,000 in 2002 to over 14,000 in 2015. Non-methadone synthetics, which include fentanyl, they've increased sixfold. Deaths from benzodiazepines, same thing, increased from approximately 2,000 to 9,000 per year. It's not good news, but it's an interesting point that deaths due to cocaine have been essentially flat over this time period, but they still have claimed the lives of approximately 7,000 people per year throughout this time period. And to make that bit of news even more frightening is that since 2012, those deaths have begun to edge up again. So all in all, in 2016, there were over 64,000 deaths from drug overdoses in the U.S. Remember the Vietnam War? 58,000 deaths in the entire war. So we're losing more men and women each year due to drug overdose deaths than the Vietnam War happened in that many years. Can you go to the next slide, please? Well, this is hitting a little closer to home, isn't it? That the dark colors here in your slide are the states that have the highest mortality rates due to opioid overdose in 2015. And yeah, Maine's there. Maine, New Hampshire, Massachusetts, Connecticut, Rhode Island, a lot of Midwestern states. And it's interesting that a lot of these states, from our work, we found that a lot of the major hubs tend to be along major transportation routes, perhaps that's no surprise, but it certainly is consistent here. Also, if not that it's apparent on this slide, but if we did have 2016 data, we'd notice that in Maine and several other states, the mortality rates have gotten worse. Now, from the employer's perspective, addiction has been affecting workers and workplaces for a long time. We've talked about that a little bit. Certainly, alcohol has been a perennial problem. And then in the 70s, if you recall, the 70s, there were methamphetamines, the cocaine epidemic in the 80s and 90s. But the opioid epidemic is really grabbing everyone's attention today because of the overdose deaths. It kills rapidly. Alcohol kills too, but it can take decades. Where opioid deaths happen to employees at all economic levels, and it tends to be a more hidden illness as well. Complicating things further. Caitlin, you can advance the slide, please. Talk about some things that can confound a difficult situation. The landscape is changing, so we have this conflict of this horrible epidemic with the opioids and other drugs as well. But then we have states that encourage the legal use of marijuana, and certainly we could talk back and forth about the connection between marijuana and other drugs, but certainly employers who are screening for any drugs, including marijuana or opioids, are sometimes caught in a very difficult situation here. Next slide, please. So we have this perfect storm, and this is really highlighted by the increased substance use disorder spending, which has been increasing every year, trying to keep up with the needs, certainly. However, even though spending has increased dramatically, as we've seen before, the death rate is still marching on, still progressing too. So we do have this perfect storm of, we have this burgeoning problem. We have sometimes conflicting or unclear laws and regulations. We have a short-term labor supply issue too. It's tough to find, it's tough to hire the right people. And certainly with these other issues mounting in the presence of trying to hire and keep the right people, it makes it that much more difficult. And also we have evolving but still unproven strategies to address the issue. Oh, by the way, you still need to run all other aspects of your business. So there's a lot going on. It's a real challenge. Let's go to the next slide and briefly cover a couple other things here. Thank you. So let's look at a couple things that frame the discussion in Maine. I talked about some conflicting regulatory issues or laws. Let's talk about those for just a moment before we turn the presentation over to Dr. Saito. Opioid prescribing restrictions are in place at 23 or more states right now, and Maine was a leader in that regard. 18 or 19 states have drug testing provisions in their legal codes. At the same time, we have federal agencies like the DOT, like DOD. They require workforces and contractors and subcontractors with which they work to implement some sort of drug testing and policy programs. So this is what I was referring to a few moments ago, where there can be some conflicting forces between the requirements of the federal agencies and the states. Next slide, please, Caitlin. Thank you. So on this slide, we can see that some more details about what's going on here in Maine. It's, with the exception of employers working under federal mandates, Maine employers wanting to enact a drug testing program must have a policy approved by the Maine DOL. So there's provisions here certainly that are in place that can support and help businesses, but there are still some counterbalancing forces as well. So between the difficult regulations and this burgeoning problem, well, back to what I started with when I first spoke to you a few minutes ago, this really is the world in which we live, and so what do we do as a reasonable approach moving forward, and more specifically for your purpose? So what's an employer to do? So now that I've set up this morass of questions and this difficult situation, I think it's time for Dr. Saito to step in and give us some of his particular insight. Dr. Saito, welcome, and take it away.
Great, thank you, Scott. All right, can everybody see my screen?
Yes.
Okay, great. So thank you, Scott. That was a great intro to this. I just wanted to give a brief overview of sort of what we do at Maine General Workplace Health, but also to make it more Maine-centric, to talk about sort of what are we seeing here in the state of Maine and the employers we work with here in central Maine, and the idea of how do we get more services out to the community. Because at the end of the day, the employees that make up the communities are responsibility of the employers, but I think overall, we do all have a responsibility for this. So if everybody can, I'd like to, if you could just log onto this website if you already haven't. It'd be nice to be able to see sort of everybody's responses as to what kind of opportunities we can sort of tailor this talk towards you as well. And the first, great, we already have some respondents. So I just want to get an idea of who else is on the call right now. And it seems like we do have mostly HR and healthcare professionals, and a third of others. Maybe I should be a little more specific, but as we go through, and feel free to ask questions, we'll figure out how to tailor this a little more, but I'll make it a little more HR centric and some healthcare centric as well. So where are we all coming from? Is everybody able to log on to the site and see if you can give some respondents? So most of us are from central Maine. Great, so we have some southern Maine folks as well. So we've got good representation, wonderful. So we have Somerset, Kennebec, Cumberland, Waldo County, Knox County, Lincoln, perfect. So mostly people in the central Maine area and up in Penobscot, wonderful. So this gives us a good idea of sort of where we're at and sort of this area of interest, especially in this area. I can talk more too about the services we currently offer and sort of what kind of drug screening programs we currently have. So feel free to keep on answering some questions and we'll get through that as well. So what kind of industries are you currently practicing in? Give me an idea of how to tailor this talk a little more towards where you are. So healthcare, okay, well, that we definitely talk to about. Construction is number 2, and sort of manufacturing and others as tertiary. So I'll try to tailor our talks towards these folks. If anybody else has a specific question to your industry, feel free to chime in. And it's always a presenter's fear when you have others as the most common respondents here, because that makes it a little more challenging, but I'll gear it towards mostly healthcare, construction, and manufacturing, and as we go through as others as well. Again, remember, Caitlin mentioned you can also type questions into the chat box. I also have some questions at the end as well. So we'll make sure we save some time so we can go through and answer your specific questions that might pop up as we go through the presentation today. But I'll focus on healthcare as well as construction, manufacturing, and administrative as well. So do you currently have any kind of drug screening policy at your workplace? I'm always curious to ask this to see where we're at with this, and I'm surprised that a majority don't who are on this call. So this is great. So this is a good opportunity because those who are on it probably are not as interested to find out more about it. But if we are, we can answer both questions as well. So I look forward to discussing and having this conversation with those who don't. And let's see at the end of this conversation whether you'd want to change your mind and have a policy. Now, those who do have a policy, I know is a minority of us, are you in a regulated sort of environment or non-regulated? Or if you had no idea what that means, let me know as well, and we'll definitely address that through this talk today. Don't you love live polling? This is great. So most of us don't know and goes back and forth. So keep on answering. We can always go back to this. I'd be curious to see once everybody gets a chance to respond whether we can get some more interest. So if we don't know, that's a good thing. So we'll go through today's presentation and talk to you about why I think it's important to have some sort of process in place so that we can offer drug testing and how does that really involve with safety? What is the connection? The first question I usually get is, show me the studies that show the benefit. Why should I drug test? And that sometimes is a philosophical question, whether you ask it at a society level or whether you ask it as an employer. And sometimes there are different answers, but in this case, I think it's one and the same. You have to wonder, well, is it truly safe for someone, or are we doing it for other reasons as well? How do we balance that with the risk associated, whether that's a cost associated with it, or are there other indications of not having enough of a workforce, as Scott mentioned earlier? If you only get 3% to pass your drug screen, how are you going to have a workforce that is able and ready to work for you? So let's give you some good data on this. So Drug and Alcohol Testing Industry Association and the Society of Human Resources Management actually did some surveys a couple years ago looking to see why should we do some drug screening and what's the benefit of it. And they're finding that workers' comp incident rates actually drop about 57% if you introduce and implement drug testing programs. And then if you look at some of the National Survey on Drug Use and Health or the Substance Abuse and Mental Health Services Administration, they're finding that almost 9% of those employed full-time report use of illicit drugs in your workplace. That's concerning. I mean, that's almost a 10%. So 1 out of 10 almost shows that they are having a use of illicit drugs. And then DOL, Department of Labor, estimates that about 65% of on-the-job accidents are related to drug and alcohol abuse. And about 40 to 50% of all workers' compensation claims are related to alcohol and drug abuse. So these are concerning statistics when you look at this, whether you're from HR or safety, even as healthcare practitioners. I think it's really important to understand the impact of this on the workplace. And it's important because the workplace has a huge contribution to the overall community and society that we live in. So what do we see now? When you look up on sort of news, these are some of the things that pop up in Maine. We're seeing different interesting sort of idea of what's going on in Maine specifically, and what's going on with opioids. And we're seeing high rise of fentanyl use as well, as Scott mentioned, with non-synthetics. And it's becoming an issue, and it's an issue that's going to trickle into the workplace. And we're seeing the statistics that back that up. So what can a workplace and what can employers do? So we got to look at different types of workplace drug testing programs. And some of these are sort of in Maine sort of identified more as sort of applicant-based or employee-based, which is more of the random for-cause and post-accident drug test. But rather than looking at these in sort of 4 different silos, I like to make it sort of a continuum of the 4. And to be able to do that, you need to understand the why behind that. And that why, as we mentioned, is the health and safety effects. We have data to support that now. We have all these different trade organizations and association nationwide that has a statistic to show us what is that. And as Scott mentioned earlier, in the state of Maine, we actually have DOL helping us with this and developing policies and procedures that we can have in place and templates actually available on their website, open to the public, to see what we can do to help promote health and safety of our employees through a good workplace, a drug-free workplace policy. And so in the state of Maine, these are the applicant sort of substance abuse testing policy, and these are the tests that are allowed. So these are sort of the state approved one that you can see, and here's the link to the website. You can take a look at it and see whether it's a good opportunity to just review some of the policies they have on their website, but also a good template they can use and to offer you an opportunity to review what kind of drug screening you want to do. And the most common question I get here now is, well, then which one of these should I be checking off in my workplace population? And that's the key. To me, it should be tailored to your workplace. What are you seeing as a concern? What are you seeing in your population, in your employees? What do you need to do for applicants that are coming in? And that's a discussion that I like to tailor around the specific employer and what the needs are and the rationale behind drug testing. And what can we do for those who want to do an employee policy? So those of you who have 20 or fewer, you could do these multiple sort of spheres I talked about earlier, whether it's probable cause, random, you want to do arbitrarily, or you want to do a combination of probable cause or random. And don't forget, for those who have more than 20 employees in the state of Maine, EAP is required. That's Employee Assistance Program. So let's talk about those probable cause random testing. What do they mean? So luckily, the state of Maine actually tells us what it means. So you can actually go through the website and they'll tell you exactly what is for. If you have reasonable suspicion, if you have any probable cause for that, if you want to do a random poll, or if you want to do arbitrary testing, then this might be a sort of obligation you need to do, whether it's anniversary or a contract or whatnot. So there's different ways of doing this in the state of Maine for employees who once they're started work as to what kind of options they have for drug testing as well. So this kind of summarizes, so what are these testable substances and how do you collect them in the state of Maine? So this is really nice because it actually tells you what the screening process is, and if those are positive, what do you do to confirm that? So to do that, you need to understand what does screening mean and what does confirmatory mean. So in order to understand that, you need to know what kind of tests are being done. So depending on what kind of sample you're collecting, whether it's urine, hair, surprisingly we still do that, it takes a little bit more time. Oral fluids is actually becoming really popular now. A lot of studies are starting to come out to show that there is an equivalency between oral fluids and urine. And the good thing about oral fluid is that it's a little easier to collect than urine. You don't have to worry about someone being able to urinate when they come in. You don't have to worry about any kind of observed drug screenings you might have. And the equivalency is very similar. However, if you're looking for drugs that don't have confirmatory or screening cutoffs, that is sometimes more of a challenge. But as the technology evolves, I see sort of we're shifting towards this. It's less invasive, and it's easier to do, and it's sort of the wave of the future. But we're not quite there yet. We're soon to be. So stay tuned. And these are the different tests here as well. So let's get into some data and understand what do we need to do to help employers understand what drugs should they be testing for and why. And I think it's always good to have data to support your decision-making process so that it truly is evidence-based. And you can see here of the opioids we're seeing in females versus opioid in males is still the #1 indicators of controlled substance. And this is data from the prescription monitoring program and results from different pharmacists interviewed a few years ago. It's a really good study that actually looked in our database where providers are mandated now to utilize to indicate what kind of prescriptions are offering to their patients. And now this year, we also have mandates on how much morphine equivalent so we can offer for employees basically on an acute or chronic pain symptoms. And you can see for that reason, this is why you can see that sort of upward trajectory in the opioid usage amongst females and males. And then you look at benzodiazepines. That's really important as well. You can see a trend going up for both females and males as well. And that trend is sort of on the way up. So that is one concern we need to look at. The good news is we're starting to see now with stimulants in both males and females, it's heading down in that downward trajectory, which is great. And it's still an opportunity to look at it and to screen for it. But if depending on your age or your workforce, this is why it's important. If you're sort of in this area down here versus those up here, there's differences in what you think you should test for and what you shouldn't test. And this is why it's important to look at your specific industry. And we have some data on that as well, is to see whether if you're in agriculture versus manufacturing versus construction, what are we seeing? And how do we decide what drugs to test for in your population? So this also helps because the prescription monitoring program tells us specifically what class of opioids are being prescribed. And from that, you can sort of guesstimate based on your gender, whether it's males or females, and the age group. And surprisingly, or not surprisingly for some, it's opioids is the top 3. And you can see that. And then you can see here, as I mentioned earlier, fentanyl is getting up there after opioids. So, and as you notice, it's not on the list for the state-approved testing for now. They're working on that, and stay tuned. And then you can see as the data supports it, the testing will also have to change and go along with that as well. So this is good to have. So now you know sort of what the age group is, the gender, and sort of based on objective data, these are the most common sort of drugs that are being screened positive for and being prescribed by providers in the state of Maine. So this provides us with some challenges that we have. So what do you do with some conflicting regulations? For example, we've seen that in marijuana recently. What do we do when we have different situations that Scott mentioned with the workforce shortage? If you only have 2 or 3% passing your drug screen, how are you going to support your work staff and your workforce and be able to have employees that are able to work and be healthy and safe at work? And that's a challenge because you need to balance it out. It's all about risks and benefits, right? So the risks of doing drug screening and the benefits of doing it needs to be weighed every single time. So it sometimes becomes more of a philosophical question like started off with, why drug screen at all? And that's a question you need to have with your management team to understand whether this is the right move for you or not. And there's a lot of growing awareness of consumer rights, and you can see that with the different movements going on throughout the US, but also the idea of autonomy. And I think that's important as a healthcare provider to understand that, we no longer practice in the paternalistic view anymore. And to be a true provider and a great provider, you need to be able to understand and be able to promote some of the consumer rights and understanding and then giving the reasons to why we do certain things, especially when it comes to procedures and also in treatments of opioid addiction or other substance abuse. So there's also continued stigma, of course, and there's a huge cost. And that's a whole talk in itself. But presenteeism, if you show up to work but not being productive, how do we know how much of that is being affecting your productivity, especially at work and they're coming in and they're impaired? Absenteeism when you don't show up at all. So what do we do? So luckily, when we talked about some sort of challenges, especially around marijuana, there is a Maine Medical Use of Marijuana Act that helps us understand that. I'm not going to spend too much time on this because it's a whole talk in itself, but we have the website and a citation here, so you'll be able to see that and click on the link and understand the concept of this a little bit more, and sort of what to do about people who don't know what to do. Because right now, as it stands, an employer may not refuse to employ or penalize a person solely on the status of their status as a qualifying patient. So what do you do when they're on a medical marijuana certificate and they want to start work and their drug screen comes back positive? So there's two options to that, right? Either you test and you decide what to do with it, or you don't test at all. And that way, this doesn't become an issue. So there are some DOL successes and recommendations to help us with that. And that is first is to develop this drug-free workplace policy. And luckily, if you go to the website, they actually give you a whole list of different policies and different templates you can actually use to fill out and use that as an opportunity to review what can be tested in the state of Maine, what can't be tested for non-regulated, that is. Those under the regulated or the federal standards, you have your own prescription that you need to follow through as well to do that. I'm talking about here the non-regulated, which is specifically state of Maine drug testing. So the department also provides guidance as this, and then you could also develop this with some of our help, and we can be happy to talk to you about that and how to do that as well. So how do you have a successful approach? I think it's always most important is to have clarity of what you're trying to do. And what kind of internal management support do you need to have? Besides HR, do you need safety involvement? Do you need your occupational medicine support? Do you need a medical review officer to help you understand and review some of your policies? And we got to look at some methodologies and how do you ultimately plan to assess whether this is successful or not for you? And how do you validate that these information sources are correct? And you need to have this consensus around that. So you need to have a plan, existing reporting process, and where possible, you need to be able to have a good buy-in from the different stakeholders. So what do you need to include in that plan? So first, as we mentioned, you need drug-free workplace policy, but you also need some SAMHSA drug-free workplace toolkit. So these links will be all available to you, so you can go through and review some of this. Unfortunately, we don't have enough time to go through every single one, but it's nice to know you have resources out there. So you can go to the websites and actually see some of these are free of cost. So it's nice to be able to offer that to your supervisors, to your management team, but also to your employee, because a lot of it comes down to the education as to what their rights are, but what's the rationale behind why you're doing this? Like the first question I asked today, well, what's the philosophy behind it? Why are you drug testing? What's the purpose? And that way your employees have that buy-in for you as well. I think more importantly, as we can see, most of the sort of shift right this past decade or so has gone to sort of supervisor training, especially around impairment. And SafetyWorks at DOL offers a great complementary course to understand how do you understand when an employee is impaired? Because at that point, it's a different question you're asking is, are you screening? Not really. Here, you're actually saying you see impairment, and how do you judge impairment? And that's something a healthcare provider can help you with. So those of us on the call that are healthcare providers, these are going to be important questions that are going to be posed to you in the future, is that how do you judge whether someone's impaired from the substance that they're coming in for, or are they impaired, question mark, in general, whether it's substance or not. There might be organic features that can cause impairment. Are they just hypoglycemic and that's why they're fatigued and passing out? Or are they on a substance withdrawal? And those are questions that need to pull in some of your clinical skills to make that kind of judgment. And I think also importantly, and I think a lot of people kind of leave this out, is the EAP program I mentioned earlier. So if you have more than 20 employees, it's required for you to have EAP, and folks need to know that we do have opportunities to develop that program to fit the needs of your employees as well, and to have the appropriate professionals doing the screening process as well. So there's some structural, operational, and also some technical challenges to avoid. But to have a successful program, I like to sort of break it down into sort of 3 different areas. So you need to be able to do more than just saying it's a safety issue. Explain why behind that. And I gave you some statistics to use earlier, whether you're from HR or from safety, you can have that sort of data to use as justification of why it needs to be done and how do you adhere to these policies. And to develop that policy is the key, to have this drug-free workplace. State of Maine DOL has free templates for you to look at online. And I think it's very important to develop an early relationship with EAP as well, because that's going to be your key to help develop a program. And how do you support those who do come back positive? when you see that we have this opioid epidemic, not only around the nation, but as you've seen earlier in our slides, it's happening in Maine. So you're bound to have this positive pop up. And what do you do when that happens? And having that relationship with the EAP early is very important to do that. And documentation is very important. And this is why I think I encourage everyone to go to the sort of impairment training. The supervisors can help understand when they see impairment, get them into the provider early so we can make that assessment for you to justify that impairment. And if safety isn't a concern, that's a really good way of looking at it. And then having a drug screening professional on staff to be able to recommend the various drug screening policies. So communication is also key. So here we really need to focus on what kind of messaging you want to offer and how do you want to communicate that? Because there's multiple ways of saying the same thing, but there's ways of saying it that you could be sort of more sensitive, but also have good buy-in from those who are that are going to be either participants or managing these drug screening program for you. So, for example, instead of using addict, using person with substance use disorder, alcoholics, or person with alcohol use disorder, and feel free to go through and read through this as well. So this is a good opportunity to review sort of communication styles and how do you best offer the opportunities for the employees to understand these are the options, why we're doing this and why we're offering it to them. And there's some non-impairment agreement samples you can use, and these are also available on the website, so you can download this. But it's really nice because it gives you language, and then you just fill in the blanks and use this as an opportunity because DOL spent a lot of time working on this, and Amanda over at DOL has been doing a great job with putting this together and really ahead of the game and looking at what needs to be done in the next step. So I think it's a good opportunity to utilize some of the work that she's put together with her and her team and be able to use some of this opportunity to say, let's make this for our company. And it's not a lot of work because the template's out there for you. You just need to decide some of the big decisions that needs to be made and checking off some of these boxes and entering some of your information for your company and having it sort of a designated employer that could be a representative for your plan as well. So how do you start finalizing your plan? So I think it's really important to be able to draft sort of documents that can be used as for guidance for some of your near-term activities, but also start reporting early. So for your long-term activities, you can have a good early jump into what you're going to try to measure as part of your outcomes and what do you consider success? Because with any programs you introduce, there's going to be a cost associated with it, and your CFO is always going to ask you, what is the benefit of it, and what do you measure as success, and what's the outcome you're looking for? So it's important to have that early and be able to document that early as well. And you want to be able to engage your leadership and employee members. This is the stakeholders I was talking about. You need to have that plan put in place so that you can have that updated. And I think it's really important right now. Talk about a dashboard because that's how you track success. We've always talking about lean processes. How do we apply different sort of Toyota methods to healthcare? And we're trying to do that right now and developing a dashboard to see kind of what kind of progress you're making and the successes that you're having, or maybe things that aren't working. And it's a good opportunity to say, okay, then let's try something new. And reporting out regularly is important because this way it makes it consistent, makes it part of the culture. And as you all know, culture definitely eats strategy for breakfast. And there's a reason for that, because once you have a culture in place, you don't have to do a lot of work to make this program work. It's the employees that can be driving it. And that's the environment you want to foster and create. And then definitely document how policy reviews support that purpose. So what are we seeing in the future trends? So going back to another article that was using some of the prescription monitoring data program and broken up by county. So if you're looking at sort of Kennebec County and some of the other central Maine counties, we're in good hands. We're seeing that as we address some of the opioid addiction problems, you can see the arrest by county is going down. But unfortunately, our friends up north, they're having some issues. You can see that increasing, and that's going to become a problem because that's a trend. And that trend is what we kind of look at as sort of a leading indicator as to what we need to do in the workplace. Because you can see over here as well, with heroin usage going up, that's a concern. And we can see some of the opioids going down, and some of the stimulants continue to go up as well. So these are trends in sort of arrest records, and that gives us a sort of an indicator of what to do. And what do you do about that? So luckily, this just came out in the news last week, hot off the press. We're using other means of drug search, and Duke is great. I actually used to work at a Center for Smell and Taste and at the University of Pennsylvania. We actually did find canines tend to have better smell than most men, and surprisingly, a lot of female law enforcement officers do have equivalent sense of smell. And it's become a big issue, especially in law enforcement right now, as to whether humans have the capacity to make a probable cause arrest or to stop a vehicle, to test for some of these trained canines that can actually do a better job at sensing some of these drugs that we need to look for. And I think these are some of the drugs that are approved to be tested in Maine. So we got to understand and look at this and look at the trend and seeing where the data is changing so we can change with the times and understand what do we need to do to make our policy maybe relevant and in the right time frame as well. So staying abreast with what's going on in arrest records, what's going on in the community, and what can we do to help the employee and our population is very important. So we can actually use some of this data to go about doing that. But you can see the cost of doing this. It's not cheap, but there's opportunities to contribute towards this as well. And I want to just touch briefly on alcohol. It's an interesting topic. And just last week, actually, there was a good article that came out of The Lancet, which is a really big time journal in science, and it looks at sort of the risk for threshold for alcohol consumption. We have a lot of partners that we work with in central Maine, and one of the top conditions that we always have that it's hard to close the care gap on is alcohol consumption and binge drinking. Unfortunately, that's a big issue in Maine. A lot of data show that consumption of alcohol, especially binge drinking, is a big concern that's hard to manage and to be able to meet some of those care gaps to do. So what did this study show? They looked at over 600,000 people around the world, and they actually did this as a prospective study. So the strength of this is actually really good. And they showed that if you drink about 100 grams or more of alcohol a week, which is about a drink a day, 7 drinks a week, you're at a higher risk of death. So that's actually big, right? I mean, the outcome here is looking at death. So that means your life expectancy decreases with more alcohol you consume. And lo and behold, they did the study and they confirmed it. So you see both men and women, they have the same effect. And you can see men is a little more drastically and women less so. And it's interesting to see that as age increases, you can see the decrease as well, but it's a lot steeper for those who consume more than that. So if you consume more than 1 or 2 drinks a day, you're at a higher risk, and you can see how steeply you drop in your years of lost life. And this is statistically significant. So this study just came out last week, and a lot of people are looking through the data now, combing through and trying to get more industry-specific data. So it'll be nice to know. So those of you working in construction, healthcare, how does this affect your workforce, and what kind of opportunities do you need to help with some of those who do have conditions that are putting them in this risk category? How do you avoid the steep drop-off in their life expectancy? Because that's a big concern. You don't want them to lose half a decade of their life for a disease that we're hoping we can catch early and be able to help them and get through that program. So let's talk about the future for the last couple of minutes here. What do we do about, how are we going to treat addiction? And MIT, actually, this just came out last week as well. There's a really good research out of the Harvard School of Public Health that looked at addiction in general, whether it's behavioral or substance abuse, and treating it with an app. I mean, surprisingly, unfortunately I have the slide here, but if you look around the world, worldwide, people have access to cell phones, smartphones particularly, more than they have access to drinking water. Not only that, but if you look at some of the recent data that came out, people are looking at their screen on their phone 20 times an hour. That's a lot. So they're actually looking at a phone multiple times, whether it's text messages, emails, or other kind of social media. They're looking at their phone roughly 20 times an hour. So to capitalize on that, this researcher at Harvard School of Public Health said, well, can we use that as change behavior as a way of looking at how to affect behavior based on small changes on using some of the smartphone applications that they have? And lo and behold, the data hasn't been published yet, but it soon will be, showing that there is a change in behavior, and this change is actually pretty significant. Some of them are showing between 10 to 20% of those folks who are on the apps are able to change their behavior, whether it's personality disorder, substance abuse, or other reminders that they get on the phone that helps them understand that. So at Maine General, we're currently sort of using a new platform and developing something with our phones and apps using our Virgin Pulse platform. And you can actually track a lot of that. Not only do we look at physical activities, this just happened this morning, so I've walked since then, I promise. And to be able to understand, and the ecosystem you develop is key. And having friends available and social network. There's a lot of research coming out now looking at how do you develop a social network that friends who are getting well together stay well together. And that we see that true for physical activity. If you have a significant other or a spouse that you go to the gym with, studies have shown you stay in the gym a lot longer, you tend to be more physically active. and be able to work on their interest. And some of the program we're going to work around with our current application is to say, can we help them have change their behavior with this app itself? I think using some of the artificial intelligence data too, coming back from it, predicting to them what their interests are, we can sort of use that as an opportunity to say, well, let's help that behavior change occur, what your interests are. And that would actually help moving you towards a behavior change overall. So there's some drug testing resources, the regulated for the DOT, for example. You can look at some of these links and we'll have this available to you as well as to what you can do to look at some opportunities for regulated, non-regulated. So hopefully folks know the difference between that now. So the non-regulated state of Maine, regulated are those federal standards, whether it's DOT or other FAA or other agencies that require that. And we here at Workplace Health will be happy to answer questions for you. And I appreciate your time. I know we have about maybe 14 minutes for questions and answers. So hopefully we have some good questions here. So feel free to either chime in, check in your box, or you can go ahead and go online and type some questions in. We'd be happy to answer them. And I'd like to turn it back to Caitlin.
Thank you, Dr. Saito, and thank you, Scott, for this wonderful presentation. At this time, we are opening it to questions from you. Since there are a lot of you on the phone, we are going to keep you muted just to make sure there's no background noise as you're munching your lunch or have patients or whatnot wandering around. So if you have any questions, you can type it into polleval.com/medlaw. It'll come up on the screen. I believe it is anonymous, so feel free to ask any question you have. You can also ask questions in your chat box. There's a question thing. You can drop questions in there, and you can send it either privately to myself or potentially to everyone if you really wanted to. You also can raise your hand by clicking the little hand bar, and I can unmute people individually if you would like to ask a question. So if you have any questions, feel free to start typing, and we'll get through as many as we can. And if you have questions after this as well, we have contact information for Scott and Dr. Saito here if you want to reach out to any of them and ask more private questions or follow-up questions as well. We do have a question. I have one question coming in. Can you say more about best practices in determining impairment?
Sure, I'll take that one. So impairment can be sort of determined in multiple different ways. So to me, I always like to know, first of all, what is the employee's job title? What do they do? And sort of what company they're working for. So that gives me an idea of what environment they're in. And then in my mind, I like to classify it as to whether they're working in a safety sensitive position or not, because that makes a big difference to me. If you're in a safety sensitive position, for example, you're a law enforcement officer, you're a firefighter, you're a physician, someone else's life is in your hands, my impairment judgment is a little lower. So if you're coming in and you're unable to have any kind of psychomotor or even cognitive abilities, that's an indication for me saying you're not safe to go back to work. And we could either accommodate you in different ways or not have you be in that work environment. So it's really a one-on-one interaction that needs to occur. And depending on sort of what the medical rationale is, whether it's metabolic or it could be foreign substance abuse or synthetic substance abuse or withdrawal, it depends on what that is coming in, then we can make that as an opportunity to do the further workup and go down the algorithm of whether this is something that needs to be treated medically, or is this something that needs to be basically self-sufficient in a couple hours once the half-life of the drug wears off, or if it's a withdrawal, then we need to treat that as well, because that can be sometimes life-threatening. So the decision needs to be made right away whether it's life-threatening to them or not, and whether it's life-threatening to others or not, and that's how we kind of judge what kind of impairment we should judge for, and that's what providers are there for. The supervisors could definitely do the initial screening of that. And as I mentioned earlier, SafetyWorks offers a really good program to understand what is considered impairment and whether you can use that judgment as a screening process so that you can go to the provider, a healthcare provider, to confirm that for you as well. Let's see, another question we have here is, how do you recommend introducing your EAP substance use agreement policies to current employees? So that's a tricky one, because especially if you're going to be starting something new, as you know, most people don't like change. So with change comes responsibility, and a lot of that is communication. So working with the EAP professional is the key, because they have the experience on talking about this kind of issues, and they have a lot of data to support it. And I think from my experience, it's always important to say the why. As long as you explain the why, a lot of folks are willing to help support that and to be more willing to buy into it. and give them a good rationale as to why this is helping them, helping their communities, and helping the workplace be a safer and healthier place to be at. And that's usually a really good starting point. And at some point, too, it's always nice to bring in a provider, whether you have an MRO or not, the medical review officer, or if you have a medical director that works with you. It's always nice to bring in a provider to show them that you're there to help them. It's not just your employer trying to be difficult, but it's actually there trying to help promote the health and safety of the workplace. And usually that's a really good way to start that and getting that introduction to get this sort of get that agreement policies in place for them. And you can always work with DOL as well, using their template. They actually walk through that for you and give you different steps as to how to do that. And it's a good opportunity to get started on that as well. Is there a possibility of seeing legalized marijuana legalized marijuana use leading to decreased levels of opioid abuse? So the studies on this is still mixed. You probably see a lot of popular media talking about how marijuana is the answer to the opioid epidemic, and then a week later you get another article saying, no, that's not true. If you take some other confounding factors into place, and you lose that statistical significance. So this is one of those things. Is coffee healthy for you or not? Are eggs good for you or not? Is cholesterol good or not? And unfortunately, it goes back and forth, and it's challenging. So this one here again, I always like to indicate it more as a individual basis to see what what are the benefits and the risks of having marijuana use at the workplace, and whether that's an opportunity saying, you know what, it's fine. And sometimes people aren't necessarily impaired. The challenge with legalized marijuana, and especially recreational marijuana, is we don't know at what level it causes impairment because it differs in different people. And with the cannabinoid system, some people say it could be reset. So you have different levels of tolerance depending on how much you use or abuse it and how much you don't use it. And as most of you know, it's actually stored in your adipose or your fat tissues. So it leaches out over time. So sometimes it could take months or a month for some of the levels to decrease. So to judge that and to use that for impairment is challenging, but to show that it actually decreases opioid abuse is not quite there yet. So stay tuned because they're trying to do more research on this. Previously, it was hard to because the federal government didn't allow you to do any research on Schedule I medications or Schedule I drugs, such as marijuana. So it's been a challenge, but with some recent changes in regulation last year, researchers are able to use more of the data and to start studying this a little bit more. So I expect to have some more good data, hopefully coming out at the end of this year, so we can have that relationship between marijuana usage and opioid abuse. And some good promising data is coming out of Colorado, who's had this on for a while now. And there's actually social determinants too, showing that legalized marijuana may or may not affect different socioeconomic statuses, imprisonment, education. So they're doing a huge study on that right now, so stay tuned. Will this webinar be available so it can be viewed again, or the slides be available to the links? I'll pass it on to Caitlin. I think it would be.
Yes, this webinar is being recorded, and we will make both the recording of the webinar and the slideshow deck available on Community Health Options website, which is healthoptions.org. I will also follow up with an email as well, sending these documents to you as well. We are also going to send out in that same email to just a follow-up poll to see if any of your employers, anyone on this webinar, and also people who weren't able to attend, if they're interested in a follow-up presentation to this, and if there's anything else you would be interested in learning about as far as workplace drug testing going forward. So I think that answers that question. I do have another one, a follow-up to the marijuana question for you. What portions of recreational marijuana law have gone into effect and what has not?
Scott, do you want to try to answer that question first?
Well, I'm afraid I don't have a lot of details regarding the timeline of the specific components of the laws and regulations. So I'm afraid I can't speak to that. But what we can do, Caitlin, is do a little digging and get that answer for the person asking the question.
Yeah, that'd be great because it's still up in the air and there's a lot of questions about it. But for at least medical marijuana, we do have some answers, and I think I had a slide on that here. Sort of what do we do about that, especially at the workplace. There's also a Maine State Supreme Court case that went to oral arguments a few months ago too, as to whether insurers or employers are responsible for paying, reimbursing marijuana for some of the workers' comp cases too. So that hasn't been answered yet either. So I think there's a lot that needs to be answered within the state legislature right now, and I think that's still pending. So I think there's more to come, but at least we have some guidance here, even though it's not really clear. And as I kind of touched on this earlier, it's a challenge because some workplaces, if you test for marijuana, more than 50% of the workforce will be positive. So what are you going to do about that? You know, is it better to know and not care about the results, or is it better not to test at all and not know? So there's different ways of approaching it. But I appreciate your question because it is a confusion, and that's one of the challenges right now is where are we with marijuana and how does that affect the workplace specifically, because we don't know what the guidance are. And if you come up with a policy now, you might have to change it again in a few months when some of the legislature actually finalize some of the rolling out of their policies, and they're still working that out. So yeah, we'll send out an email with maybe a better answer to that, but that's my initial feelings about it.
Great, thank you, Dr. Saito and Scott. I'm not seeing any other questions come through my question asker thing. I don't know if you have any on your end, Dr. Saito.
Yeah, let me check. Let's see. Go back to that slide. No, I think these questions already popped up earlier, so.
Okay, great. Well, thank you everyone who attended this webinar, and a big thank you also to Dr. Saito and Scott Good and Mike Gendro for taking part in this presentation. I hope you all learned something today, and if you have any follow-up questions, again, we will make this, this webinar and the slide deck available on the Health Options website, and we'll also email it out, and we'll also work on getting you an answer to that marijuana question as well. And if you have any follow-up questions directly to our presenters, their contact information will be in the slide deck as well, or if you want to jot this down, their emails and phone numbers are available. Once again, thank you all and have a wonderful rest of the day.